All right, Dr. Morse, quick question. In response to the 21-year-old who is 6'1", you mentioned due to his height, you know pituitary is involved, more than likely. Can you explain further, what is the normal range of height for men and women? That's a good question. I'm going to say, generally speaking, look at the Islanders. Generally speaking, I'm going to say probably 5'8" to just under 6 foot would probably be normal height for humans, but I don't even know what's normal anymore. You know, and women the same way. I think 5'6" to 5'8". When you're down, you know, obviously short compared to everyone, 5 foot, or you're obviously tall, then there is some pituitary influence on that, no question. We see this with the kids. We're getting a lot of kids here that are not growing well. Now, of course, and as we fix up the children, as we get their pituitaries on, they start catching up in their height. We just, some sweet little Amish girl had a real problem with this, and now she's catching up. She's perfect now. When is the pituitary suspected? Too short, too tall. Pituitary is also suspect. Good questions. Pituitary would be also suspected in female menses, when you have irregular menses, or when you start way too early in life, or you start way too late in life. Definitely would be suspect. Even in a hypothyroid case where TSH is involved, that would be suspected. It can be suspected in parathyroid because it controls these. But in pituitaries, even can control urination. And this is the thing. And I've said this before, I do not know what role the pituitary can have in kidney filtration. But this is the CNS. This is the boss. So, I don't know. You know, it's just like maybe a medical doctor that had more training in brain and relationships of the pituitary hypothalamus area to that could probably help in that way. Some of the MDs I've talked can't answer those questions for me. But, you know, it's all, these are questions that are new for all of us, and I think that I've asked them for quite a few years, though. But these are questions that our society needs to start thinking and associating the parathyroid, thyroid with what? The pituitary. So the more you look at a case and the more you see more of the endocrine glands involved, and you see someone 5 foot and their menses was irregular, you know immediately it takes you right to the pituitary, and it's suppressing all the other glands. So you always should work on that when you have a situation like this. If you have a pineal or pituitary weakness, what other tissue is involved? And I'll give you a clue, it's not even up here in the head. Oh, I heard you. I heard you too. GI tract. GI tract. You got to clean up your bowels. I've always said to clean up your head, you got to clean up the bowels below, because your head kind of sits on them. Now, this kind of makes sense, you know, to clean up what's down below. And then things can flow. The sinuses can flow. And you see that in bowel movements where you have a big bowel movement and your sinuses start draining. Shows you the interconnection of the whole body. It's amazing.